Well, thank you so much for coming. Uh, why the reason that many agents, many treatments for sepsis failure? But I think it's talk about these reasons in before presentations. For example, in 2006, we have protein S, tissue factor antagonism, and Chigris. You have a positive results, and the early goal direct therapy, the study by very important that changed so much the management of sepsis, no? But this is 2006, and you know the importance of early goal direct therapy by compared of normal attention of sepsis, and the use of Chigris is stopped because the results in the other trial is not positive. So in 2023, we have a control source, antibiotics, and supportive treatment, only one. After many decades, you have the same treatment for sepsis. And the great problem is that we think that use only one drug is possible to treat all kinds of sepsis. We talk about the phenotypes, different genotypes, the relationship between bacterial such as Haemophilus influenza or Pseudomonas aeruginosa is completely different. The inflammatory signals is different. So it's make this different in the moment of the treatment. So the personalized medicine is a crucial to understand this difference, to understand to adaptate of genotype, phenotype, adaptate the necessity of this patient is different of one another patient. So is that this heterogeneity in sepsis, it's a normal. So it's a very important to understand the metabolites, the protein signatures, and the different endotypes. For example, the immune exhaustion or immunoparalysis is a very crucial to understand the response of one or another treatment. And of course, the personalized therapies to improve the survival of patients. So I like so much this study, this review talk about the relationship by transcriptoma, proteinomic, metabolomic, and genotypics. And if you can see in the part of the slide in the inferior, this is a pharmacokinetic and pharmacodynamics. This is a normal concept that you use day by day, but you have another two concepts is a pharmacometabolomic of pharmagenomic. So it's not possible only use a PK or LPD concepts to develop treatments. And a few years ago, our group published this review or this opinion about the first moment of COVID-19, and you talk about the personalized treatment adapted at different phase or different degrees of severity by personalized by COVID-19. So as you can see in this slide, there is a very different types of treatment. You talk about cytosorb, the use of antibiotics, the use of polymyxin in hypoperfusion, the use of drugs to attenuate the immunoparalysis. One example is a use of interleukin-7 in different group of patients. So the relation between the host and the pathogen and the use of antibiotics is a very important to understand. You talk about PKPD is a parameter, is crucial to make a good administration of antibiotics, but this is necessary to improve this approach. This is a use of personalized antibiotics that depends of different phenotypes, characteristics of patients. It's not the same doses on patient with obese patients or other patient with 40 kilograms, for example. No? And the immunotherapy in the last years, you always studies in immunotherapy in sepsis failure, and the reason is use of this immunotherapy for all kinds of patients, for all kinds of infections. It's a different gram-positive infection by Staphylococcus aureus and a fungus infection by aspergillosis, for example. No? But it's different trials. Any trials will have a good results. In another study is a different. This main reason is a different populations using these studies. For example, it's very important to know the target that you use in the immunoanalyzing cells. For example, in this study, in the right, the problem is the cellular exhaustion, the increase of apoptosis, cytotoxicity. But on the other hand, it use antibody of this cytokine is possible to decrease this immunoparalysis and increase the activation of the macrophages against the infection. So the interleukin-7, the possibility to administrate interleukin-7 in different points of the inflammatory way is, you can see that improve or stop the stimulation. Bacteriophagos is a very old therapy, more than 100 years, but now, sorry, as you can see, is many studies, recent studies in bacteriophagos use in respiratory infections and sepsis. And as you can see, this is a use two mechanisms. This lysis of bacteria or the dormant bacteria that's incorporated inside the bacteria and destroyer. And it's very important because bacteriophagos is the most common entities of the earth. This is a natural enemy of bacteria. It's a specific. It's a capacity to proliferate in the infection site. It's possible to destroy biofilms. It's an intracellular parasite for bacteria. Sorry. So this is a selective against one specific bacteria, decrease inflammatory, increase the sensitivity of antibiotic, increase the penetration of biofilms, and the very important, maintains our microbiota different of a normal antibiotic. So this is an antibiotic treatment. And finally, the nanotechnology, the nano treatment of patients is a possible use a different materials, different gold, for example, gold particles, or use of different materials. No? This is a size of the nanoparticles dedicated in. Yeah. Okay, only one. This is one example that use of nanotechnology, nanoparticles in Escherichia coli, in red, in green, the nanoparticles that destroy this. Thank you so much. Sorry.